Good morning, everybody. Welcome to another Mancoll Minute. Hope you had a great week. Sunny out, can't ask for more than that. So listen, I've gotten this question a couple of times, and it's a very common question. And that is, I've got loose skin, not too much fat, but I don't like my loose skin. What are my options? And it's a great question. And this is where I think patients spend a lot of money going to some medical spas or things where they promise them a tummy tuck like result with just some external energy. And I gotta tell you, I'm very skeptical. I've been doing this for 23 years, and I have a ton of patients of mine who come in who are super fit, super thin, moms particularly, or high weight loss patients, not a lot of fat, but the fibers in their tissues have just simply been stretched. Just like if you had a sock, you stretch out, it just doesn't stay up. So although I believe a lot in some minimally invasive energies, mostly radio frequency, I think there really are, depending on the degree of skin laxity, there's really only a couple of choices that are truly worth the time, energy, and treasure. In my own practice, I have two different ways I can tighten skin without truly doing a tummy tuck. We're talking someone's abdomen. Brachioplasty, we're talking someone's arms. Thigh lifts, we're talking people's legs. Mastopexies or breast lifts, we're talking people's breasts. And those ways are this. I have something called Smart Lipo. It is a laser, and I have to go internally, and that energy sort of gets transmitted to the bottom of the skin where it creates a reaction due to high heat. And that will cause some contraction. It can be used to break up fat and to melt fat, so to speak, but it is minimally invasive. It is not external. And I also have what I've replaced Smart Lipo with for most of my patients, something called Renuvion. This is the wand I use. Renuvion is really a form of radio frequency. And just like with Smart Lipo, through a couple of little poke holes, I go in and I treat not just the undersurface of the skin, but really what's called the fibroseptal network that attaches the skin to the fascia or the lining of the muscle, and it causes that to contract. It can also cause the fascia itself to contract to some degree. But what I like to tell people is that if I'm comparing what I can do with a tummy tuck as the maximum amount of tightening that I can achieve, we'll call that 100%, these technologies can achieve about a 30% skin tightening. They don't happen right away. It's a process of stimulation that happens over the course of 6 to 9 months. And I just had a patient back earlier in the week who I had done her legs, and she was telling me how much tighter her skin felt. And when you look at pictures, it's clearly better. Is it as tight as it would have been if I did a thigh lift? Of course not. But she's really happy for what we were able to achieve through just a series of little poke holes. And I do these typically with people asleep under anesthesia, because I'm generally treating broad areas like an entire abdomen and flanks and upper back and so on, and that's hard to just numb up. So in my opinion, external skin tightening, and I guess I should mention I do have something called Body Tight as part of my laser platform, but I gotta tell you, it's a lot of treatments, and the results from what I've experienced I think are okay, but I worry about how many treatments you need when you start adding up all the costs of it, versus just simply it'd almost be the same as just going right at what I can do minimally invasive. So the options, again, just in a quick review: Body Type, which I think is okay at best; minimally invasive with either Smart Lipo, Renuvion, or J-Plasma, whichever term you want to use, same company; and then ultimately the gold standard is going to be an excisional operation where I'm doing a tummy tuck or a breast lift or an arm lift or a thigh lift to get rid of that extra skin. So hopefully that clarified options. If you have any more questions, feel free to call the office. Happy to see you, happy to sort of get a feel for your skin, see what I think it might respond to, and then see what your goals are and take it from there. Have a great weekend.